Are cluster headaches covered by health insurance plans? If you or someone you know suffers from cluster headaches, you might be wondering about health insurance coverage for treatment. Let's break down what you need to know. Cluster headaches are known for their intense and often debilitating pain. They can cause significant distress, leading many to seek medical help. Most health insurance plans do cover the diagnosis and treatment of cluster headaches, but the specifics can vary widely. First, health insurance typically covers medical evaluations and diagnostic procedures. This means that if you visit a doctor to confirm a cluster headache diagnosis, those costs are usually covered. Prescription medications are also generally included under pharmacy benefits. This includes both abortive medications, which are taken during an attack, and preventive medications, which aim to reduce the frequency of attacks. Now, when it comes to treatments like high-flow oxygen therapy, things can get a bit more complicated. High-flow oxygen is often prescribed for acute attacks and is recognized as an effective treatment. However, coverage for oxygen therapy can vary. Medicare used to have a national coverage determination for home oxygen therapy specifically for cluster headaches, but that was retired in 2021. Now, local Medicare administrative contractors make those decisions, which means coverage can differ depending on where you live. For private insurance, coverage for home oxygen therapy is not guaranteed. Many insurers will cover it if it is deemed medically necessary, but you might need prior authorization. This means you will have to provide documentation from your healthcare provider explaining why this treatment is needed. Some insurers might even exclude coverage for oxygen therapy in episodic cluster headaches, but may cover it for those with chronic cluster headaches. Patients with cluster headaches often face higher healthcare costs due to frequent visits to doctors or emergency rooms. While insurance can help reduce these costs, out-of-pocket expenses can still vary based on your specific plan and the treatments you need. If you are dealing with cluster headaches, it is essential to check with your insurance provider about what treatments are covered. Make sure to ask about home oxygen therapy and any newer devices that may help manage your headaches. Having thorough documentation from your healthcare provider can support your case for coverage approval. In some instances, you may need to appeal a decision if coverage is denied. This is often necessary due to the unique nature of cluster headaches and the specific treatments involved. In summary, while cluster headaches are generally covered by health insurance plans, the specifics can vary significantly. It is important to communicate with your healthcare provider and insurance company to ensure you understand your coverage and get the treatment you need.